Okay guys, so first thing you want to do before you start your facial exercises is sit correctly in the direction that you want to have your line of symmetry at, where it was before you started mewing. Because I started mewing and it started pulling my line of symmetry to my left. So to my left. So in that case, it made my whole body face to the left. So now we need to bring it back to my right. So in that way, I pull my left leg up like this, crisscross, left leg, left foot on my right knee, and then I'm gonna bring my left hip forward and then focus to keeping this flat on the ground but still kind of back, so it makes you like turn back to the right, as you can see. So that's how we start the daily morning routine. See, I just woke up, so I haven't done it yet, so you're gonna see how I start changing. But I've done it for 3 months, so don't be discouraged if you don't see it first. Like, it's gonna take at least a month first before you start feeling all flexible again and breathing right, and then after 2, it's just gonna keep going exponentially. So with that, hip forward, facing where you want. You find out where your symmetry is by knowing which direction your nose is pointing off the center of your face. Yeah, you can see right here, like it's actually kind of over this way. My ears, how you see how it's like kind of my face is pointing this way a little bit. That's what we're trying to work against. So now we're gonna start by doing just my facial exercises, which would be this. I'll probably point it back to me eventually, but it's fine. So we're pretty much trying to twist our face on our skull, on our skull on our neck. Pretty much trying to twist it back because our whole spine got twisted up. It messes with our whole skeletal system. So we're trying to really just open back up. So you're gonna be just rubbing your face a lot. Pretty much gonna be focusing on like your nose, your eyebrows, but you're pulling in a direction. See, I'm pulling to my right and kind of like twisting inward, but also like moving, like you're pushing inward. You don't want to be pulling out, because if you're pulling outwards, it's gonna just like bend. It's not gonna really go into your skull and bring your face back into your skull. That's what your goal is, to bring it back. To bring it back. And you're not really mewing anymore, because if you mew, you're pretty much focusing and relying on your tongue to hold up your face, which is not good, because you need your teeth. Your teeth are there for a reason. They're strong. They have grooves. They have ridges. They meant to catch each other. So if you're sleeping, you can still hold your whole head up. Because if you're using your tongue, how are you gonna like use gravity or work against gravity at a right angle to hold your whole head together? Like, it doesn't make sense and it actually hurts you. So here we go. I'm gonna show you my whole thing. You see how my spine is like pushing this way? It's trying to fight me pushing to the right, because it's like all on my left side. Like, watch. You see my neck? How it's like right on the left? Like, it's like hard. So you gotta work on your neck a lot too. Like, just make sure you just don't do too hard. Dude, at first you're gonna be doing this all gently and but deliberately, but gently. And then you'll be able to you'll feel it start to like crack and like pop a little bit, but that's good because you're popping yourself back into place. But don't press too hard. So you're just like slowly just twisting, but like pushing more to the right. Your whole spine has to be pulled off that way. So just remember that this case is on my right, so make sure you know which direction you're pointing. It could be to your left if you got pulled to your right. So this is just the beginning of the exercises, because you have to work on your teeth too. That's pretty much the step 3. We already covered step 1, hips, and focusing on going to your right because your nose is off center if it's to the left. And now we're doing our facial exercise, which is pushing our face into our inward, but like still to the side we want. Twisting every little part, your cheekbones. Make sure you just, like you're doing this. Push in, but like twist. You gotta feel everything sort of together. Make sure you breathe while doing it. Don't forget your hips are one's left, one's forward, so you're feeling everything just kind of move. And you also get push on your chest. Don't forget about the sides of your head and the back of your head and the top of your head. I was messing up not doing the top of my head for a minute, but like now it's doing a lot better. And the eyebrows are really important because that's generally what's going to dictate your chin length. So you want to make sure that's pushed back too. When this all is pushed back, it makes it all look better and like more normal. I got like no sleeve too, so don't mind the bags. No sleeve. Okay. See if this looks better. Okay, so now we're doing that. Like a lot's not gonna be moving that hard because you have to be focused on your teeth simultaneously. Like during maybe before or after, you can do it before or after you do those. But I would recommend doing the hips first so you know beforehand. So this is the tricky part. You gotta, beforehand, you can tell where my line of symmetry is when you like open up your mouth. What really moved when you do mewing is your upper jaw. Your upper jaw got moved or tilted or twisted. So when that does happen, like you'll notice if you move your bottom jaw to the direction where it will like make your chin center with your face. Like watch. See how the chin is center? See how the line is not? So at that, I'm gonna try and grab like where my wisdom teeth were moved. Not grab it, but like first feel it with your thumbs. So make sure your fingernails are all filed, like not sharp to where if you slip, you don't want to cut your gums, because I've done that before and it hurts, but it'll heal eventually. But yeah, just fair warning. So you just go over your thumb and kind of go like the top of the roof of your mouth to where your mouth roof meets your wisdom tooth area, like where it was. And you can feel like if you have it removed or have not removed, you'll feel where it is or like where the root of it was. I don't know if that makes sense, but like, yes, you go there and you're pretty much pushing up and inward into your face, like twisting it back. So in my case, I want to go right. So I'm twisting that back so I can move my whole everything, starting with that tooth, start moving it back in place. So I can start moving every tooth, sort of. The motion is just be like, just slowly, like just do that. you're pretty much trying to bring all your upper jaws will got pushed down technically. We're not, yeah, technically got pushed down. So you're trying to like pull it back up into your skull, so your whole face is like more together. Your bones get can latch onto your muscles easier, or vice versa, and like you're become more accentuated. You'll start seeing your cheekbones again. That's what we're trying to start doing. Like I just woke up, so like as soon as the day starts getting going, like I'm gonna start looking better and better because the muscles are being used in the right spots. So sleeping is another category. You gotta always make sure when you're sleeping, yeah, your left, in my case, my left hip is forward and my right hip is like, you know, face. So I'm still facing, even when I'm on my side, I'm facing the right direction as if, you know, I was correct. So that's important. So even if you have to sleep on both sides equally, so your head, because when you're on your head, like all your weight is like on one side, so it's just laying there pushing up against the wall. So as you can see, my neck, I used to think sleeping on one side was the key to fixing it, but no, because all your weight gets stuck and then your neck pushes up to the wall too. So that's why my left side is like that. So we're trying to, you know, move it. So part of the facial exercise, you also want to do back of your head. Pull it back, like towards, you know what I'm saying? Pretty much want to imagine you have a face the same on the back of your head. So you want to do the same thing, just mirror it, just mirror opposite, like so it's still going to your right. Like I want it to go to my right, I go over here. So I want it to go still on the back side. Everything has to go like this. Because that's what happened when mewing. When you're mewing, your whole head was going like this, the other way. So you want to pull it all back. The nose is also really important with this area, because this area like hangs. So you want to make sure you're pushing upward, but still pushing inward, but moving it, like rolling it sort of, but like you're like pivoting sort of backwards. And this area is really important too in the side of your head, because that's what like pulled your whole jaw that way. It's like a whole muscle you're trying to like, bone and muscle you're trying to like bend back this way. So be careful, like don't do it too hard at first. Like I mean you do it pretty good, but like just, you know, just don't be worried, tripped out or scared or uncomfortable. If you start feeling uncomfortable and pain, because it'll start stinging, but like you'll be all right for a second. Like you'll hear popping sounds of anything, but don't overdo it. Do it at least once a day. And yeah, I mean, back to the teeth, like that's also very important to hit. Like all three of these things they all kind of work together, because everything is together. Your whole body is one, you know. And it fixes your eyes too if it gave you cross-eyed before, because your teeth, when they move, these are eye teeth. They must, like, these line up with your canines, like your pupils. So like if they get closer from your palate getting smaller, then yeah, your eyes get closer together. So as you can see, you see the white line at the top of my mouth? That has to be straight up and down with your spine. So before my white line was like it would go straight and it would curve to my left. So you can see where like my spine like move this way. So that's what these exercises are doing. They're pulling you back. And then look at the beginning of the video and now look a little bit to now. I mean, it's not gonna look that drastic at first for you, but like I'm at 3 months exactly, like crazy. Let me know if you have questions. Hopefully I explained it better. I'll make better videos. Let me know.